All right, for this next section, we're going to talk about the anatomy of the pharynx, which is the top part of the throat and the back of the nasal and the oral cavities. It's divided into three sections. The top is the nasopharynx. I know, clever, nasal cavity, nasopharynx. Usually only air goes through there, although of course if the uvula doesn't close this off enough, then food can get up there. But of course the soft palate blocks that. It's lined, like the rest of the nasal cavity, with the pseudostratified ciliated columnar epithelium. The next section is the Oro Pharynx at the back of the oral cavity. And like the rest of the oral cavity, it's lined with stratified squamous epithelium. Both air and food are going to pass through here. Air is going to go down the trachea, food is going to go down the esophagus. We'll come back to that one when we do the digestive system. The lowest portion is called the laryngopharynx. Laryngo is the adjectival form of larynx. So whenever you see that, think larynx. The laryngopharynx extends from the hyoid bone here to this little section where these two tubes, the trachea and the esophagus, split. The auditory tube, or the eustachian tube, you remember that from when we studied the ear, that opens here into the nasal cavity, into the nasopharynx right there. Okay, so that's what that is. And then the other thing that we see in the pharynx are the tonsils. Tonsils are clusters of immune cells. So it makes sense that we have them here where it's directly exposed to the outside environment. These are filled with white blood cells that can readily recognize pathogens and start an immune response. There are three groups of tonsils: the pharyngeal tonsils, the palatine tonsils at the back of the lateral side of the oral cavity, and then the lingual tonsils right on the back of the tongue itself. And all three of these, there's a set on either side. So there's actually 6 tonsils. If you have your tonsils out, most commonly it's either these lingual or palatine tonsils. The ones you can feel with your fingers, if you feel like, oh, maybe I'm getting a sore throat, those are your lingual tonsils, these ones down here. Okay? The pharynx ends here at the epiglottis. The epiglottis is a piece of elastic cartilage. Remember, there's only 2 pieces of elastic cartilage in the body, the epiglottis and the external ear. The epiglottis, when you swallow, folds down and prevents food from going into the esophagus. Again, we're going to come back to the esophagus when we do the digestive system. So the epiglottis, every time you swallow, flops down, covers up the trachea, then opens back up so that you can breathe. Notice the trachea and the esophagus are really distinct. The trachea stays open, and it's actually held open by cartilage. It's always open so that you can always breathe. The esophagus doesn't need to always be open. It's actually just a soft tube that collapses when you're not swallowing. That's the esophagus, or sorry, that's the pharynx. And that was a nice short little video. Then we're going to step in the next one to the larynx, this next section right here.